Healthcare in America is sick.
We can have the cure for cancer, but if half the public doesn't trust us, then those cures are no good.
Dr. Marty Makary is sick too. Sick of the pricing games hospitals play with insurance companies and insurance companies play with patients.
Billing quality is medical quality, and financial toxicity is a medical complication.
Dr. Makary says 1 in 5 Americans currently has medical debt in collection. Yet he finds on average, doctors believe more than 20% of all medical treatments are unnecessary. And most of it is far too expensive for all the wrong reasons.
Price gouging and predatory billing, if we can be honest with the language, is threatening the great public trust in American hospitals. That's a disgrace. That's a disgrace to our profession, and it's a disgrace to our country.
And Dr. Makary has been traveling the country, documenting what's wrong with medicine and how to fix it.
Politicians, by and large, talk about different ways to finance the broken healthcare system and not how to fix the broken healthcare system.
Dr. Makary believes patients have more control over billing than they realize, and that we all have the power to change the price we pay. Dr. Makary, welcome to St. Louis. Thanks for being with us today.
Great to be in Missouri. Good to see you, Paul.
Thank you very much. So, The Price We Pay is the name of the book. I'm wondering about the we part of that. Do we all pay a price for what's happening with the cost of medicine? I mean, I've always had very good insurance and have been happy with it. I've never really gotten stuck with a giant bill, and so it would be easy for someone in that position to say, we seem to be okay, but I know it's not that way. How much of the population is really the we part of the price we pay?
Well, everyday Americans are getting hammered right now. People are getting crushed with their medical expenses. Businesses can't compete with businesses overseas because of healthcare costs. Starbucks spends more money on healthcare than they do on coffee. General Motors spends more money on healthcare than they do on steel. It's completely out of control. And if you look at what we spend on healthcare without even using the system, you'd be amazed at the many hidden costs. I mean, take for example, all federal spending. 48% of all federal spending goes to healthcare in its many hidden forms. It's not just Medicare and Medicaid, it's up to half of Social Security checks now used for Medicaid copays and deductibles and coinsurance. The Defense Department has its own healthcare system, which is 8% of their budget. The VA health system is about 4% of all federal spending. And we also cover employee benefits for all federal workers and their family members. That's 9.1 million people. We are spending 48% of all federal spending on health care. So think about that next time you file your taxes. And then health insurance costs $18,000 per household. And then you get a bill after spending all this money and you're told, hey, this is not covered. People have a right to be upset. This is not the problem of the everyday hardworking American that has health insurance. This is our problem in healthcare. This is a cost problem we need to control.
Is one of the biggest surprises when you have some sort of procedure and then you find out, you know, your doctor was in network, but the anesthesiologist wasn't, and then you get this giant bill or this in-network, out-of-network thing, I think is what catches a lot of people.
It's a crazy kind of bait and switch almost. People are going in good faith with insurance to an in-network hospital and getting clobbered with multiple out-of-network bills. And there's just no fairness in the pricing sometimes. Look, most doctors try to do the right thing always, and most hospitals are led by good people, but a fraction are responding to the opportunities to price gouge. If airlines had no prices on travel sites, and airlines simply billed you after the flight, that would enable price gouging. And that's what we have in healthcare, it's what we have in drug pricing. This is our problem and we need to get a handle on it. And the simplest way is to get fair and honest prices to be transparent.
Do doctors even know what these procedures cost? I've been astounded a few times when I've been recommended something that I suppose is sort of elective. And I say, well, what does that cost? Oh, I don't know.
I love being a doctor. I have no idea what most of my services have cost until I've had to really investigate and try to get out why is the price inflated and then discounted. You know, we've got good people working in a bad system in American hospitals, but this crazy game that we've inherited where we inflate prices to offer selective secret discounts to different insurance companies and employers and individuals, it's kind of crazy. And if you think about it, why aren't we offering one fair and honest price? It doesn't have to be the lowest price. If we've got great quality, charge more. But this idea that you go to a restaurant and ask to see a menu and they say, who's your employer? Oh, well then this is your price list, and you're gagged from showing those prices to anybody else. And you could be eating at a quarter of the price or 10 times the price of the table next to you. That's the insanity of these money games. And this is what doctors, quite honestly, are getting sick of. Doctors are rising up now, offering transparent pricing. They are being the advocates for their patients that are getting price gouged in the marketplace. And for people who get these egregious bills, I tell them, don't be afraid to talk to your doctor about these bills. Engage your doctor. Many times when patients have been sued and had their wages garnished, and my team takes on their case in court pro bono, we start with the doctor, and the doctors are not only shocked that the patient's been sued over a bill, but they are livid, and they become a champion internally to make billing practices more fair and honest at their center. Billing quality is medical quality. Financial toxicity is a medical complication, and taking care of an entire person means taking care of every aspect of their care.
So you say talk to your doctor, even if it's something that a hospital has done. I would think the first thing you'd do is talk to the hospital.
Well, many times we show doctors these bills, a bill for $650,000 for a spine operation, and they are outraged. They know the market-based price is roughly $30,000 to $50,000 for that particular operation in that particular patient's story that was told on CBS recently. And they are fighting internally to make sure that these practices are more honest, the billing is honest, and pricing is honest. Look, no one is more frustrated about these crazy money games than physicians. If you look at all the stakeholders in healthcare, all the stakeholders are getting rich, except doctor and nurse salaries have been stagnant for 30 years. This mass growth of a back industry that we call the repricing industry not only costs a lot of money to sort of negotiate and reprice all these services, but there's a lot of staff that we have to hire for it, and quite honestly, it's exhausting. Talk to everyday Americans who are fighting their medical bills, calling a call center, talking to a receptionist that does not have the power to even fix a mistake on a bill. It's exhausting. And so we've got to look at the whole system. And I think the cool thing right now is good stuff is happening. We're seeing these online transparency platforms emerge, websites like MD Save, GoodRx. You can look up on fairhealth.org the going market price in your area for a service. People are Googling their medical codes on their bills. They're finding mistakes. They're talking to hospital leaders. Look, we need public accountability for American hospitals. Most hospitals do the right thing, but some are price gouging, and that price gouging needs public accountability. Go through your doctor, start with the billing office, talk to the executives, go to the CFO, talk to the hospital board members. After all, their job is to provide oversight of a hospital leadership. I'm on a hospital board myself, and the idea of a board is to be a liaison with the community for public accountability. Right now, these many money games of price gouging and predatory billing are threatening the great public trust in American hospitals. And that's very concerning. As a doctor, I'm very concerned about that. You know, I've got partners that say, why are you working on this issue of billing and pricing in healthcare? I do a lot of pancreatic cancer surgery and GI surgery. And my partners sometimes wonder, why are you spending all this time on this, defending patients in court who are overcharged? And I tell them, we can have the cure for cancer, but if half the public doesn't trust us, then those cures are no good. And right now, we have 64% of Americans saying that they've avoided care or delayed care because of fear of the bill. We have 24% of Americans saying that they altogether don't get care because of fear of the bills. Half of women with stage 4 breast cancer report being harassed by medical debt collectors. That's a disgrace. It's a disgrace to our profession, and it's a disgrace to our country.
Well, and talk about being harassed or even sued. If there's one place in America apparently you don't want to get sick, it's Carlsbad, New Mexico.
Yeah.
Talk about that. It's in the book. It's fascinating and distressing all at once.
Well, I had some patients reach out to me about their stories of being overcharged. And one of them was from Carlsbad, New Mexico, a single mom who had some kids, 2 of whom had special needs, and one of them got a little sick. It was more of a scare. Went to the hospital. The kid got an IV, probably only needed an hour of time of treatment in the hospital. But the IV got infected, and the kid had to go to the ICU for what we call a hospital-acquired infection. The hospital then sent the mom a massive bill. She does not live like me. I visited with her in her home. Look, God's been good to me. Half of America has less than $400 of cash in savings. I was reminded of that when I went into her home. And that bill was devastating. It was devastating to her life. She's done nothing wrong. She has a full-time job. She has health insurance. And the hospital then sued her to garnish her wages.
Even though the hospital was responsible for the infection.
Yeah, it was a hospital-acquired infection. 20% of all medical care is unnecessary in a national survey of physicians. So we're actually shaking people down with predatory billing practices, sometimes for things that were not even necessary. And this hospital has sued, the word is in town, they've sued everybody, a town of about 28,000 people by census data. They've sued the judge. When the judge got medical care, they sued the judge not realizing who she was. And so we've been going to these towns, trying to create public accountability, asking the hospitals to please have mercy on these patients. Remember why we went into medicine. Remember when hospitals were built, most of them were built by churches, and they had a mission to serve their communities. Let's remember the great heritage of medicine. When Salk invented the polio vaccine, he refused to get a patent, so he said, as many kids in the world can get it as possible. He said, this will be a gift to humanity. It is the property of mankind. That is our great medical heritage. And that great public trust is now being threatened by these many games.
You go to bat for a lot of people all over the country, which, I mean, you have a practice of your own. It's remarkable that you can even find the time to do that, much less the incentive to do that. But for people who don't have someone to represent them in that way, what can they do? Can they negotiate prices with a hospital after something's been done and you get that shocking bill?
Yeah, one little known fact, Paul, is that most medical bills are negotiable. Most hospitals, if you get to the right person, are actually reasonable and will try to work with you. But this sort of barrier that's been created, this mass barricade to prevent you from really getting to the right people, is a real problem. And so we tell people, keep fighting. We've listed 20 ways you can negotiate your medical bills on our website, restoringmedicine.org, which is our student movement to call out the medical system and remind people of our great heritage in medicine, and we want to restore it back to its mission. People should look for mistakes. They should go beyond the call service representative. They should talk to someone who has the power to at least correct a mistake. We're talking to hospitals now, asking them to take a code of conduct for honest and fair billing practices where they can at least give people the courtesy of having somebody within 15 minutes talk to them about their bill. Look, if you bought a car for $20,000 and you couldn't even talk to the person who sold it to you 10 minutes later, and you got put through multiple voice menu and get hung up on and told, this is our policy, we can't do it, you would say, look, this is not an honest business. And right now, people are fed up. People are angry. And they're starting to get angry at us physicians, and that's where this is getting personal. Look, these money games are now threatening the great public trust in the medical profession. People will trust you as a physician to put a knife to their skin within a second of meeting you. Or they'll tell you secrets they've never told their spouse immediately. Why? Because of the great public trust in the medical profession. That public trust now is being threatened by these predatory billing practices. And if all the channels don't work, go to the media, go to the hospital board members, go to the executives, create public accountability around these billing practices.
But what incentive really do hospitals have to work with the patient negotiating? Just the fear that if they don't, the patient will go bankrupt and they'll get even less, or what?
They have no financial incentive, but there is a moral case. And most hospitals try to live up to that moral case, but that's why we need public accountability. Look, these are not brick and mortar businesses that get set up on a for-profit basis. That's never been the goal of a U.S. hospital. Hospitals were built mostly by churches, and they were built to be a safe haven for the sick and injured. And so we've got a responsibility to the community, and the community has a responsibility for public accountability. Look, I think we've got good people working in hospitals. We just need to appeal to the best in folks. Right here in Missouri, we've got St. Luke's Hospital that has an incredible policy for billing. They will work with people. They offer massive discounts for anybody who can't pay. They really have these very strong firewalls set up, so nobody will ever be shaken down for a bill unless they're wealthy and agreed to a price and are a deadbeat on their bill. We doctors need to be paid for our services, but the policy, you can see, is extremely generous. It's kind, it's merciful, it's compassionate. That's what we need more broadly. There's a lot of stuff we can do if the government does nothing. Look, I have a right to be a little skeptical about the government. I live in the Washington, D.C. area. Special interests are very powerful. Okay, and I'll meet members of Congress who will tell me off the record, once they get a couple beers in them, they'll say, Marty, you're spot on with this stuff, but I can't touch it. The leadership of the Congress is telling me we're not going to touch this. The special interests will kill me in the next election. And that's where our democracy is supposed to kick in and say, hey, wait a minute, surprise billing, do something. Okay, we want something on surprise billing. All these special interests, private equity funneling dark money into Congress are killing all surprise bill legislative efforts right now, every single one of them. Every different style, form, and make, they're killing any version that could rein in the price gouging that goes on out of network. That's a disgrace. People need to hear from everyday Americans who want better.
Well, and you talk about erosion of trust in medicine. The book opens essentially with the whole shenanigans that go on with these health fairs, which is just like a fishing expedition for finding patients. How can people feel confident in the medical profession when that sort of thing goes on, or when you have so many physicians now that own testing centers, and suddenly you need that test, don't you, if you go to that physician?
Yeah. Well, the good news is there's a recognition in healthcare that we've been doing too much. If you look at all of the research in the last 5 to 10 years, it is consistently showing that we've been doing too much, that we need to be more precise, that we need to move towards precision medicine. In my own field of surgery, we now know that appendicitis does not need surgery 75% of the time for non-ruptured appendicitis. Antibiotics can work and literally cure appendicitis 75% of the time. Do you think all of a sudden surgeons are offering antibiotics to every patient in lieu of surgery? People need to be educated and informed. They need to know the latest, and we don't want to create hysteria out there. But people need to know that we've been doing too much, and we know it. In our national survey from Johns Hopkins of 2,100 U.S. physicians, asking them the question, what % of medical care is unnecessary, excluding your own practice, in your opinion? They said 21%, 25% of diagnostic testing, 22% of medications, 11% of medical procedures. If we want to fix healthcare, can we start by cutting the waste? And you're seeing this mass movement of doctors now to say, hey, we're sick of the fee-for-service system. We're sick of the billing throughput model of office-based medicine and primary care. By the way, the patients are sick of it too. We want to get rid of that and start over and start from scratch. So in the book, I had the privilege of profiling a lot of these revolutionary clinics. There are now hundreds of these sprouting up around the country, some of which are essentially no cost for Medicare Advantage beneficiaries. And they're saying, hey, can we treat the whole person and forget about that billing model? Can we just take care of patients as doctors? And in the end, trust me, their costs will be less. And they're coming out 15% below the fee-for-service averages. And they're teaching cooking classes to people with diabetes. And they're managing back pain with ice and physical therapy instead of surgery and opioids. And they're talking about food as medicine. And they're getting at the root underlying causes of illness that brings people to care. And it's an exciting movement. And one of these clinics creates communities for people, recognizing that one of the great public health epidemics that we need to talk about that no one's talking about is loneliness, especially in seniors. And by creating communities, they are actually improving people's physiologic reserves. And I think it's definitely contributing to the better health outcomes that we see in those clinics.
Going back to the pricing question for a moment, why do prices vary so wildly, and is there any correlation between the price and the quality of the care?
A researcher at the University of Iowa called 100 hospitals that do the standard heart operation called a CABG, an open heart procedure, and asked, what's the price of a CABG? I'm thinking about coming there, how much will it cost me? Well, the hospitals gave them the runaround, and in the end, 50 out of the 100 gave them a price. Of the 50 that gave him a price, the price ranged from $44,000 to $500,000, with everything spread in between. He then took those prices and compared them to the outcomes by hospital using the most mature outcomes database we have in healthcare called the STS database. And there was no correlation whatsoever between price and quality. Our team took those results and compared it to charity care and found no correlation whatsoever. The pricing is random, it's haphazard, it's wild, it's dangerous. And right now, people are just falling into the trap. Look, nobody diabolically thought, we're going to make a lot of money by just gouging people. This is a remnant of a system we inherited where prices are inflated for secret discounts. And the poor casualties are the people who end up paying out of network or on their own, which is a fast-growing group of Americans, which is why we're seeing all of a sudden attention on this issue.
Well, and if even doctors don't understand it, and Lord knows they have enough to think about just treating their patients, but even if doctors can't follow along with what's happening, how's a patient ever supposed to do that? I would think it would get so frustrating you would just give up. Maybe that's what they count on at hospitals when you're calling to try to talk about a bill or something.
Well,
if you can get past the voicemail.
Yeah, I mean, it's a nightmare. And I can't show up and mow your lawn, Paul, and then send you a bill for $5,000 without some agreement. And in healthcare, we need some honest agreements. We need civility. And that's how any business operates. And now that people are paying on their own and there's more out of pocket, there's a role for civility and good business practices that are standard in any other industry to come to healthcare. And so when you go to the emergency room, don't financially sign your home away and your life away on some document. Hospitals are required to take care of you for any emergency, regardless of you giving your credit card. Now look, if you're shot in the chest or you have an emergency, we should not be giving you a price as doctors. We need to take care of you. But 60% of medical care is shoppable. And for those services, people deserve a price. And what we're seeing, and what I was privileged to profile in the book, are these centers that are now saying, you deserve a price and we're going to give you a price before the care. Here's a price menu, here's a list of operations, and we will actually give you an honest and fair price estimate that we will not exceed unless there's something very different that actually happens.
Can you as a patient, or should you as a potential patient, look around ahead of time, not about price shopping a particular procedure, but just if you live in a metropolitan area that has several major hospitals and your insurance is in network at all of them, and then you find yourself having a heart attack one day, can you know in advance which one of those hospitals might be the best one to go to, either for the outcome, which of course is the most important thing, or the financial outcome?
Yes, people should shop by outcome number one and price number two. And the outcome varies by center, but it's very hard to get at that information. Generally, you want to go with the respected institutions, the places that specialize in things, that have a good experience with a particular condition. But you also want to look around at the prices. And once you've established the places that have the high quality, Look around. I mean, first of all, just based on the fact that 20% of medical care is unnecessary according to doctors, you should be getting a second opinion anytime there's something major that you think you're going to have done that's not an emergency. And then also look at the prices. I was at the radiology department at Carlsbad Medical Center where I went to the radiology desk and said, how much is a CAT scan here? Knowing there were stories of price gouging in the community. She said, it's about $5,000, but if you go to the website mdsave.com, you'll see our hospital lists it for $500. You can go and buy it through that website. And it hit me that this honest, transparent online platform is creating a marketplace that's efficient and that's competitive. And people can make their own decisions. And I think what we're seeing is that this new movement is cutting the waste and addressing price gouging that is entirely enabled by the lack of showing prices. I'm a cancer surgeon, and I'm reminded every week that life is short, that you've got to speak your mind. And I'm encouraged by these millennials who want to be a part of some purpose larger than themselves. And I think right now it's not hard to have some sympathy for this 50% of America who has less than $400 of cash in savings, that doesn't live like me, and that is begging for some mercy. And so I think the calling here is very clear. We need to get back and restore medicine to its mission of taking care of people at a time when they're vulnerable and not taking advantage of them when they're vulnerable.
So you are optimistic this will get
I'm optimistic.
better, fixed?
In the end, I am optimistic because of the young blood that we've got coming up, because of this new generational value of doing something larger than what serves ourselves. You know, the kids coming through Johns Hopkins Medical School, they don't want a big house. They don't want to own a car. They want to be a part of something greater than themselves. And we're seeing them actively involved in innovating and driving healthcare startups and in doing business differently. And I think it takes that big sort of jolt from a new generation to really see things respond. And businesses are the ones driving this. If the young folks are giving us the great ideas and the new models of care, businesses are the ones funding it and rebuilding healthcare. And let's be honest, doctors would love to see our system fixed. I mean, we're sick of the billing throughput model. We're sick of the money games. We're sick of the public trust being eroded by the predatory billing that goes on. And so I think you're seeing people come together like we've never seen it before. And that was the fun part about writing the book, was the privilege of telling the stories of the many disruptors who have already fixed healthcare in very small pockets in small locations around the country, with stories that I think we could all benefit from.
It is possible.
I think it's possible. I think good stuff is happening.
Well, you're supposed to feel better after you go and talk to a doctor. I guess I feel a little bit better, at least, having spoken to you about this problem. Dr. Makary, thanks very much. Good luck with the book.
Thanks, Paul. Great to be with you.